And welcome back to This and That. Happy Labor Day. We've got Allan Valenzuela, president of Alliance Physical Therapy, joining us today. Always good seeing you. You always give us some great advice. Let's talk about falls. Okay, adults over the age of 65. Did you say that 1/3 of adults over age 65 will more than likely fall?
They will more than likely suffer a fall. And we're talking about 34 million Americans who suffer from some type of balance disorder, who are at risk for falls. And we've all got loved ones, and you know what that's like.
Oh, yeah.
They go from falling to a walker, some type of assistive device, they end up in a nursing home, and their lives, they become isolated.
Sure.
And their quality of life just diminishes quickly. So we've got a program to help them.
So this is a fall prevention program, and we've got a video that I want you to explain what's going on at your clinic.
The person in this video is not somebody that has a balance disorder, but when you see a patient come into our facility, you're going to see them a lot of times walk in like you see this person on the screen on a walker. They're barely moving, and the big thing here is they're afraid of falling, and fear is just one of the problems that people have with falls. We have this tracking harness system, as you can see she's in right here. So we've harnessed her in. She's attached to a track that's actually in the ceiling. So now we take away the fear of falling. We start them on their assistive device, and we get them used to that harness. And we're going to progress them from this assistive device to either a lesser assistive device or no device at all. And we'll see here as this video progresses that we're going to challenge her balance. So we're going to work on stairs, because one of the things is we want to give them the quality of life back.
Yeah.
We don't want them to be afraid of falling anymore. So if we take the fear of falling out by harnessing them, we let them hang on this device so that they can see they're not going to fall.
Sure.
Then they're willing to challenge themselves, challenge their vestibular system, their strength, their balance, in order to develop the areas that are deficient in their ability to get out of a chair safely, get out of bed safely, go up and down stairs safely, and the potential of walking again without an assistive device and getting independent.
So this right here pretty much simulates what?
That's a BOSU device. So we're especially challenging her strength and proprioception, her ability to keep herself upright. And again, this is a BAPS board here, and so we're working on tilting side-to-side activities.
Maybe
again, challenging her balance. If she was doing this without a harness, she'd probably fall down. A typical patient who's got a balance problem.
Yeah, okay.
With this harness system, we're able to challenge their vestibular, and a lot of times that's what the problem is. They've got a vestibular problem, so we might blindfold them and then kick in all of their senses, like a blind person might have, that, you know, they're challenged, they don't get to see where they're going. Well, we put them in that same predicament, and within 3 to 4 weeks, we see patients that have progressed from using a walker or a cane to not using any assistive device. And that's ultimately the goal. Can we take somebody and give them back their life so they're walking like this?
Sure.
And usually, if somebody's committed to the program, you'll see them progress to this level right here where you see illustrated in this video.
Yeah. Allan, from start to finish, I know every patient's different.
Exactly.
But is there, like, okay, we think that we can get you away from the walker in, let's say, 3 weeks or 6 weeks, or
our goal is 4 to 6 weeks to get
6 weeks, okay.
Yeah, 4 to 6 weeks to get you away from a walker to potentially using a quad cane or a straight cane. Ultimately, the goal, even within that same time period, we see people walking without an assistive device again, because maybe it was just some type of vestibular problem, inner ear dysfunction that's going on.
And a lot of it, you're just afraid to let go of the walker.
And that's why the harness is so critical, because these people, they're afraid. Once you've fallen once or fallen off balance, that whole guarding mechanism kicks in, and there's nothing really wrong with them except they've got this fear factor. When you eliminate the fear factor, people make some real progress.
And we've got about 30 seconds left in this next question. It may take a little longer than 30 seconds, but with the harness, I'm thinking, you know, to get people back on their feet, you may be dealing with like a knee or hip issue at the same time, going through this program? And all those factors, you know, come into play as well. So, but the harness will help, and the therapist will guide you in those areas. Allan,
absolutely.
Good seeing you. Happy Labor Day.
Thanks for having us.
Always some great insight, some great information. For more information, Alliance Physical Therapy, 10 locations, by the way. There's a location near you, I promise you. NoPainPT.com. thisandthat.com, and I'll be visiting one of your clinics soon, very soon. Coming up next, when This and That returns, information from the good folks at Cadis, Changing Lives. We're going to tell you about a special run that you can be a part of and how you can help the Austin Hatcher Foundation when This and That returns on this Labor Day.